few more. We're just waiting for a few more people to arrive, and then we will start. Good afternoon, everyone. I think we will kick this off. My name is Marlies Richter, and I'm a researcher at the Health Justice Initiative, and I am representing the Collective Voices for Health Access Steering Committee this afternoon. It's our privilege to launch this research report. My colleagues on the steering committee, Sharona Kambaram from the Lawyers for Human Rights is on the call, Becky Walker, who we will hear more from, and Thea de Grucci. And I will welcome our speakers shortly. I just would like to give people a sense of what we will be doing this afternoon. And I would like to ask a couple of ground rules, and this is just to facilitate the soft launch over Zoom, and that is, if people can please keep yourself on mute unless I invite you to unmute yourself and to share your remarks. I'm going to ask that people please introduce themselves in the chat box. Unfortunately, we don't have enough time for everyone to come on camera and for us to hear your voice, but please use the chat box just to say hi to everyone and to tell us what organization you're from, if you are from an organization, and where you are physically, so that we can visualize you in a specific geographic location. Just to note that we will be recording this session, and we will make it available afterwards on the web for people who couldn't join us this afternoon. And if you feel strongly that this shouldn't happen, please chat to me, and we'll see if we can edit out any insertions that you don't feel happy with, if you contributed those. Everyone who's registered for this webinar, we have your email address, and we will send you the URL and materials afterwards. And we encourage you very strongly to please use these materials. They are open access, and the further we can spread the word, the better. Sorry, I'm just moving it on. The structure of this afternoon, would just like you to see what we have planned. I am going to welcome everyone, which I have done already, and I'm going to hand over to Becky, who's one of the researchers of the report, and I've asked her to highlight for about 10 or 15 minutes some of the highlights from the report. I'm going to encourage everyone to please read the report, but Becky will help us to highlight some of the key headlines from the research that she has been involved in. We've then invited a really wise panel to remark on the report, and I've asked very specifically for our panelists to highlight one thing that they took out from the report, and to also speak a little bit about the work that they've been involved in. and to talk a bit more about that. Every participant will, on our panel will have about 5 or 7 minutes, and I'm going to be a very strict facilitator, and I will indicate when you have 1 minute left. And really this afternoon, we would like for people to participate and really engage with their reflections on the last 20 years of civil society pushback against xenophobia. Please use the chat box. I will definitely keep an eye on it to note down questions. But if you also want to keep your questions for the Q&A afterwards, we'll listen to the formal part of the presentation, and then I'll open it up for any questions or remarks that people might have. I'm gonna just give you one insight into Collective Voices for Health Access for people who aren't aware about or don't know much about the coalition. We were formed in August 2022. We were originally called Collective Voices Against Health Xenophobia, and we consist of about 60 organizations and individuals that resist xenophobia, and we are particularly focused on health xenophobia and advocating for universal health coverage for all. And we challenge attempts to target any strategies that target and exclude migrants from accessing healthcare services, and we rely strongly on our legal framework and our constitutional values. So this afternoon, you will see a little bit of the work of our partners, and I'm going to ask people to please also use the question and answer session to talk a little bit about the work that they've been involved in, and importantly, how we can build a coalition to resist the xenophobia that we are seeing in our society. I'm going to leave it there, and I'm going to ask or invite Becky to come on screen, and in the next 10 or 15 minutes to please tell us about her main takeaways from the research. Thank you, Becky.
Thanks, Marlies. Hi, everyone. I'm just going to keep my video on just so you can put a face to the name, and then I will turn it off so that you can focus on the slides that Marlies is sharing. Great. So I have the very difficult task of condensing a very rich report into a very short space of time. So I will do my best, but as Marlies said, we encourage you all to read the report. All the sort of the detail is in there. So I'm only going to give sort of an overview and some of the highlights from that report. So Marlies, are you able to share those slides? And I will.
Yes, Althea had it on the screen. We were just toggling it to the first slide. If you can just give us 1 sec, then we'll have it on screen again.
Not a problem. So I'll just start by sort of giving an overview that this report documents responses to xenophobia in South Africa from 2000 to 2022, with a particular focus on the health sector. And the overall aim of the research that informs the report was to determine what has been effective in challenging xenophobia and how to foster solidarity to inform strategic and thoughtful future action while identifying different forms and modes of responses to xenophobia, including xenophobic violence during this period. So this was based on an audit of key civil society actions and strategies that have resisted health xenophobia in South Africa over the past 2 years, two decades, sorry. And in doing so, the report explores and addresses the following key main questions. So what kinds of responses have emerged to tackle multiple forms of health xenophobia? What initiatives, strategies, and actions were taken in the past and are taken now, whether organized or informal, by coalitions, organizations, groups, or individuals? So we can move on to the next slide here. And then the last one is, how can an understanding of these responses help to mobilize more successfully in the future? So although the focus was very much initially on the public health sector, obviously we also looked at xenophobia more broadly because the two are very obviously entangled. And we looked at the public healthcare system. So that excluded the private sector and traditional health practitioners. And also just a note around, when we talk about impact or how effective responses are, obviously that's very difficult to measure. So our emphasis in doing the audit was on responses aiming for social change through challenging xenophobia and fostering solidarity to inform strategic and thoughtful action. And sort of, the basis of this, or the platform for this report, is based on two key trends. So mobilizing against foreigners has become more mainstream in politics, and mobilizing against foreigners has become more organized in the street. And I'll explain a bit more what I mean about that in a minute. But basically, what we've seen is with rising inequality, unemployment, and a public health system that's, underfunded, crippled by corruption and systemic weaknesses, we see that discrimination and violence against foreign nationals and others perceived as outsiders, such as South Africans from other provinces or naturalized citizens, is increasing. And this was exacerbated by the COVID-19 pandemic, whereby daily challenges have become much harder and people have faced more risks and vulnerabilities. And we also know that South Africa's slide towards a more openly anti-immigrant rhetoric across the political spectrum, including in the ruling party, the ANC, reflects a broader global shifts. So we see these emergent anti-immigrant movements where old and new political parties have pushed mainstream politics further towards the political right, widening the space and tolerance for more openly racist and xenophobic rhetoric. And there is a wealth of documentation in terms of some research, media reports, and accounts by organizations working with migrants, which consistently document anti-foreigner sentiment across South Africa and within the health sector, not only from healthcare workers, but also amongst administrative staff and security personnel. But also we know it's not just it is not just non-South Africans facing those challenges, but we know that those challenges become heightened when you are without documentation, when you are identified as other in some way. Before I go over the methodology, which I will do very quickly, I just want to clarify in using the term health xenophobia. As I said, obviously health xenophobia and xenophobia in general can't be easily disentangled, but we also chose this term rather than medical xenophobia to be able to capture a broader sense of healthcare beyond that direct interaction between medical professionals and patients. So health xenophobia, therefore, encompasses the provision of health services, the experiences of those who can or can't access and receive services, but also the legislation and policy, as well as administration and security at health facilities. So in terms of the methodology, we used a qualitative approach and we conducted it in 2 stages. So step 1 was online research of documented incidents of resistance against xenophobia, including the following types of interventions: legal action campaigns, dialogues, provision of reliefs. And we created an Excel sheet that documented all of those. And alongside that was a desk review of literature and research on xenophobia and health xenophobia in South Africa, which included a brief mapping of laws, policies, and advocacy campaigns that have impacted on migrants in South Africa, reports and briefings and interventions on xenophobia and service delivery more broadly, and also with a specific focus on responses to xenophobia during the COVID-19 lockdown, including access to vaccines and social support. And then we also conducted 12 semi-structured interviews with 16 key respondents. So some of them had two or three people in the interview. And this included individuals who work either individually or in organizations with migrants, both directly and indirectly, such as NGOs, international agencies, and community-based organizations, as well as activists. And from all of that, we identified cross-cutting themes, but at the center of the report, and kind of key to all of this that holds it all together, is a timeline that we constructed from the audit. So if we can go on to the next slide. So I actually think this is not the latest version of the timeline, which is in the report, but I see that Marlies has just added the link to the report in the chat, so you can have a look at the latest timeline. But this was constructed to map out the key documented outbreaks of violence, including the way that violence has played out and the responses to it. So the timeline includes some of the social and political triggers and exacerbating factors, and then identifies key responses to health xenophobia over the last 2 decades. And overall, it shows that there's been regular incidents of xenophobic violence that have occurred most frequently amongst the poor, mobile, and heterogeneous populations of South Africa's urban informal areas. And this is by no means an exhaustive representation of the prevalence and nature of xenophobia or of responses, but it offers a kind of starting point from which to strategize and plan. When I mentioned there's a later version of this timeline, what we did was we constructed the timeline, and then we had a preliminary sharing of the findings in which various different people added their own documented events and issues to the timeline so that we could make sure that we had sort of collated as much information as possible, and then we updated it. So we're hoping it's as representative as it possibly can. So the way we then analyzed it once we had the timeline in place was to break it down into 3 periods. So we looked at 2000 to 2009, 2010 to 2018, and then 2019 to 2022/23. And for the first 2 periods, we looked at what was happening at the time, then the documented responses, and categorized those responses by type in terms of collective action or legal action or protest or media statements, when it happened and who was involved. And obviously those categories aren't clear cut. They can be many different things at once, but it was just to get a sense of, whether there were certain types of responses that were happening at certain times. And then for the 3rd period, which was the latest one, we took 3 case studies. So we looked at responses to the COVID-19 pandemic in terms of vaccine access. We looked at the xenophobic comments by Ramo Tuba, the MEC for Health in Limpopo. And then we looked at Operation Dudula's protests outside public health facilities in 2022. So obviously, I don't have time to go through each of those periods, but I want to give you just a brief highlight of each of those periods before sort of drawing on the general themes that came out in the report overall. So if we go to the next slide. Okay, so in terms of the first period, obviously this is the time when we had the sort of most well-known xenophobic violence of 2008. But what we see from this period overall is that it's represented by times of extreme violence and disruption located within an increasingly hostile context for foreign nationals that necessitated responses that were immediate and short-term, as is in the case of the kind of humanitarian response to the 2008 xenophobic attacks and the raid on the Central Methodist Church, which became a place of refuge for many, both before the xenophobic attacks and afterwards. We saw a central role played by MSF in terms of the clinic that was running alongside next to the Central Methodist Church. And then we also saw an increase of sort of actors coming together and strategizing for that limited and defined time, and working on sort of attainable needs and goals, including shelter, food, and clothing. So in many ways, 2008 particularly was more of a clear-cut, defined crisis that people could, it was easier to respond to and to bring people together. But obviously, we know that that wasn't the end of xenophobic violence, nor was it the start. And so responses have been more complicated, I guess, since then, since that kind of defining moment. But what we've seen in terms of the key responses in that period that we were able to document was that there was alliance formation and collective mobilization. So there was the Cape Town Refugee Forum came together. There was the CORMSA was registered at that time. The Anti-Privatization Forum, together with a range of social movements and community organizations, formed the Coalition Against Xenophobia, and they organized protest marches. People Against Suffering, Oppression and Poverty, PASUP, also responded to the death of Adonis Msati in 2008 when he starved to death outside the Cape Town refugee reception office. And then we saw a lot of collective protest action as well, mostly in response to the 2008 xenophobic violence, and then the development of task teams such as the Western Cape Task Team that was led by TAC to serve as a command centre for relief at that time. There was also some sort of major legal action at that time. LHR, representing the Centre for Child Law, took an urgent application before the High Court on behalf of unaccompanied minors detained at Lindela. There was also the hearings held by the South African Human Rights Committee with the Parliamentary Portfolio Committee of Foreign Affairs on xenophobia. And there was a number of sort of programs around social cohesion and dialogue as well. And during that time, and key to the focus that we have in this report around health, is that the Johannesburg Migrant Health Forum was formed in 2008. And then there was also the Hate Crimes Working Group that was formed at the end of 2009 and early 2010. And both of those forums aim to create a multi-sectorial network of civil society organizations with members from across diverse sectors, which, as I'll go on to say, came out as one of the key ways in which responses have been effective in terms of cutting across different sectors and bringing different actors together from different standing points. And in terms of the kind of more specific health responses, obviously I mentioned that MSF was at the centre then with their clinic, as well as providing support to people living in so-called dark buildings in the city, and sort of exposing the challenges and the barriers that foreign nationals were facing in accessing healthcare at that time. And Human Rights Watch also brought out a report at that time, No Healing Here, Violence, Discrimination and Barriers to Health for Migrants in South Africa, which sort of pointed to abuses to health vulnerability and the barriers to accessing health. And then the second period, and again, I'll just give a very quick overview of that. If we go on to the next slide, there's two clear trends apparent in this period. So first, there was an increase in interventions meant to build social cohesion, such as dialogues and conversations organized by state and non-state actors, particularly in the aftermath of the 2008 attacks. And secondly, there was an ongoing presence of xenophobic violence in urban areas, targeting businesses and livelihoods of foreign nationals. So in particular, we saw in that time what was called Operation Hardstick in Limpopo in 2011, which was a military-style campaign by police to tackle illicit activities in the province, which, very similar to Operation Fiela, mostly targeted foreign nationals, targeted small businesses run by migrants, and made sort of, making a living incredibly difficult. We also saw violence triggered by inflammatory remarks by the Zulu King Goodwill Zwelithini, and that spread across the country. So ignited in Durban and then spread across to Gauteng and other areas. And it's also important at that time to note an increase of xenophobic rhetoric from politicians and government officials. And in the report, we have documented many of these comments and statements that have been made from the Minister for Police at the time, the Joburg Mayor at the time, the former Gauteng MEC for Health at the time, as well as our now Minister for Home Affairs, but at the time Minister for Health, Aaron Motsoaledi. So in terms of responses, we see the shift towards sort of more focused, more strategized, and more planned violence happening, and responses indicate an increased focus on and development of responses to the challenges that migrants are facing in terms of staying employed, accessing work, accessing healthcare, as well as the impact of being detained or deported and the conditions and how that affects their conditions of health. And key migrant health-related issues were also in the spotlight in this period, including the failure of the health services within the detention centre Lindela. And there was a South African Human Rights Commission investigation on the state of human rights, including the right to healthcare services at Lindela at that time, in which the report revealed a wide range of human rights violations. We saw an emergency response to the outbreaks of xenophobic violence in KZN and Gauteng in 2015. And then we saw actions like the Johannesburg Migrant Health Forum met with the MEC for Health and the CEO of Charlotte Maxeke Hospital in Joburg to address the challenges faced by foreign migrants in accessing healthcare, and took a list of cases where people were being denied access to health or being mistreated in terms of accessing health. But the outcome of that meeting did not necessarily lead to any positive steps. So what we see, particularly in that period, is that in terms of the responses, there was more response to the violence rather than the causes of the violence. As with what we saw with the xenophobic attacks in 2008, the state responded through police intervention by dispersing perpetrators or facilitating support for victims when it was absolutely necessary, even though it was clear that the violence was often organized and incited in public meetings and strategized. And despite the findings of research that also took place into the 2008 violence and the increased awareness of xenophobia as an entrenched social problem, there appeared to be little concrete programming on the ground that addressed the causes and triggers of these tensions and violence. But we also saw an increase of attempts to engage the state and demand accountability as well in terms of legal cases, and in terms of, really pushing recognition of what was happening at the time. And then in the last period, I'm not going to go through these case studies in detail, mainly because we created these really nice Miro boards which document the responses, which are in the report. And I think it's actually best to look at those to really understand how we mapped out what happened in each of those cases and the responses. But just to quickly say that as with the first case study, for example, in terms of the exclusion and marginalization of foreign nationals from the COVID-19 social support and vaccination rollout, we looked at how non-nationals were prevented from accessing state support through the social relief of distress grant, as well as the lack of clear guidelines or reassurance for undocumented groups to access the vaccine program. And then we looked at the civil society responses as well as other responses, but particularly those strong responses from SERI, the litigation by the Scalabrini Center and the Health Justice Initiative as well. And what we saw here as well was very strong links with the battles for access to ARVs and TB services for citizens and non-citizens that took place earlier on. So there was a very strong focus on health for all and ensuring access to health for all and the consequences of not doing so. With the case of the MEC for Health in Limpopo, I think there might be some discussion around that a bit later, so I won't go into detail there other than just to say we looked at how that ignited very polarized responses and also fueled protest action by Operation Dudula outside of hospitals. And what's clear from both of those cases, from Dudula and from the comments by the MEC for Health, is that they both deflected the focus on a health system in crisis and a lack of state accountability by stressing an external threat instead posed by outsiders. So they provided what many have seen as a more palatable target, I guess, and a more visible target and an easier solution, which obviously for what is now a political party, Operation Dudula, is to remove foreigners. So overall, and I realize this is a very rushed overview, but we see from the audits and from the timeline, we see that there are persistent civil society responses that aim to address the immediate needs of foreign nationals while simultaneously fighting for more awareness, long-term systemic change and recognition of the core structural issues that have led to the crisis within the public healthcare system. And to do so, a variety of advocacy tools have been used by civil society, including engaging with parliamentary mechanisms, community mobilization, protest action, statements, public education, lodging complaints with statutory bodies, embarking on litigation, and engaging community networks to mobilize. And you can see just here on the slide, these are the how we mapped out the responses to the xenophobic comments by the MEC for Health. So you can go to the report and read that in more detail, because obviously on the slide it's not very clear. If we can just move on to the key findings slide, then I can just give an overview on that. Am I doing okay for time, Marlies?
Few more minutes. Thanks, Becky.
Okay, I will wrap it up. So where the 3 case studies expose the political nature and instrumentalization of xenophobia and highlight the need to respond strategically and politically, the final part of our report looked at some of the key constraints and challenges for organizations and individuals working against xenophobia in South Africa. And obviously this was very much based on the responses during the interviews that we conducted, but it was combined with the findings from the audit as well. So if we can move on to the next slide, please. The key findings overall are challenging conditions for those working with and on behalf of migrants. So what we saw there is that the already challenging conditions for those working have been steadily deteriorating in South Africa for 3 key reasons. One is due to pervasive and increasing xenophobia, particularly since the COVID-19 pandemic. And that mobilizing against foreigners has become more organized at a community level. 2 is institutionalized and mainstream xenophobia. So organizations have been confronted with strong anti-immigrant sentiment at all levels of government, and mobilizing has become more mainstreamed. And that 3, a number of, just on the 2 as well, we also saw that there was a strong link between the impact of the pandemic on livelihoods and standards of living and the politicization of healthcare, and increasing resentment towards migrants in particular, who were blamed for the failings of the healthcare system. And then number 3 was the hostile environment, so increasing threats against those who take a stand. So we saw this with, for example, SERI in April in 2022, following their challenge over eviction of street traders. But we also saw it most recently with the tragic Albert Street fire, and the way in which SERI and other NGOs were very used they were basically blamed by the government and used to deflect any attention on their own failures in terms of that tragedy occurring. The second finding was basically outlined the key features of civil society response. So we looked at, what were the key features. So they were things like larger and more formalized social justice NGOs have been the most visible advocacy driving forces against health xenophobia, with support from researchers, healthcare workers, and smaller CBOs. The response to xenophobia is often located within existing areas of work, where organizations identified how xenophobia intersects with other key concerns, such as health access, legal rights, employment rights, or gender-based violence. So we saw that with tax focus on access to ARVs for migrants detained in Lindela, being part of a broader campaign around equal access to healthcare services. We saw it with SERI's support and representation of CACs in challenging the prohibition of anti-xenophobia march in 2022. And we saw it with Section 27's recent litigation to ensure access to free healthcare for all pregnant and lactating women and children under 6, which was situated in their work to protect the rights to access for health for all. So responses to xenophobia have had to intensify and have primarily focused on legal action against the state and against those espousing anti-foreigner sentiment, as well as more organized collective action through visible protest by coalitions. Third is the value of collaborations and partnerships. So recognizing the challenge of sustainability, the report highlights the value of diverse collaborations and partnerships. So responses that have included collaborations between organizations and diverse mandates, resources, skills, and interests seem to be most effective in terms of maintaining momentum and focus. So we have strength in numbers and diversity based on a recognition that health xenophobia isn't happening it's not happening in a silo. So responses need to also not happen in silos either. And the importance of developing and fostering interventions, which include creating allies across diverse spaces of work. So collaborations between civil society and those working within the health system, as well as between civil society organizations and researchers, for example. And here we also see the importance of research itself as a much needed evidence base that can inform and contribute significantly to the success of interventions. Then we have the making connections, the racialized exclusion as the common denominator. And what we sort of meant by that, and what became clear by talking to the key informants during the interviews, was that it's about recognizing that xenophobia in South Africa is a variation of racism and needs to be addressed as such, as some organizations already do. So working off a broader platform of racial justice, rather than just keeping the issue of migration siloed. And this was made clear sort of when it was explained that when South African health workers deny treatment or exert other forms of violence on Black Africans who seek care, they explicitly and implicitly dehumanize them, placing them on a lower rank in the global racist human hierarchy that elevates whiteness at the expense of variously racialized Black and brown populations. So although poor Black South Africans themselves are technically one rung higher because of their ID numbers and their citizenship compared to white South Africans, their rights remain nominal, not substantial. And we felt that that was a very key point to really understanding how responses have been organized and come together. Finally, holding and defending spaces and the less visible but critical responses. So this is about recognizing that there's been no big wins against xenophobia, including health xenophobia, but there are numerous actors at different levels who continuously put out little fires in ways that are rarely publicized but constitute a key pillar of protection. So taking a stand against xenophobia in everyday context plays a critical part in protecting migrants from immediate physical harm. Long-term, deeply embedded interventions nurtured by actors who are part of and enjoy trust and legitimacy in their communities are likely to do some of the most impactful work. And we've seen that recently, particularly. And even though their efforts are difficult to measure, it is these more subtle and incremental responses that should be acknowledged and better supported. So in terms of bringing that all together, obviously there's a lot there, but overall, we found that this research showed that within an increasingly challenging context, diverse collaborations and partnerships can be particularly valuable as they draw on the experiences of social justice organizations and their connections with groups and individuals embedded in communities and through their histories of local level networking and activism. And highlighting that is often the small, less visible responses that have sustainable impact. And we feel that in recognizing those, that the report offers a starting point from which to plan and strategize for the future. However, and this is my final point, considering the continued and increasing more emboldened and explicit xenophobia and the failure or refusal of the South African government to take consistent and unequivocal action against xenophobia, it's also evident that civil society responses have not been sufficient to quell and address this prejudice. So while building on the strategies of the past, new strategies, alliances, and energy are urgently needed to continue the struggle to ensure the Freedom Charter vision that South Africa belongs to all who live in it, including its public healthcare system. And I will draw it to a close there and pass back to Marlies.
Becky, thank you so much. This is a really valuable research report. And as far as we know, this is the only publication that brings together 20 years of activism. And there's a treasure trove of materials and perspectives that have been captured in this report. And I think this is really helpful in us thinking through how we can build a robust and proactive set of strategies to resist xenophobia, and I'm looking very forward to hear other people's reflections on it. I am going to ask our first speaker in our panel, Sasha, if you could come on screen and share your perspective and your work. I'm going to go off screen, and after 6 minutes, I'll just come back on again to tell you have 1 more minute. So over to you. Thanks very much, Sasha.
Okay, thanks, Marlies, and hi, everybody. So I'm going to be speaking about the history of Section 27's work on migrant access to healthcare services, and particularly a case that we brought recently to ensure access for pregnant and lactating women and children under 6 to access services. So Section 27's work on migrant health really started in about 2013, when we started assisting individuals who came to us who had been denied access to services. And for much of the next 10 years, or at least much of the next 7 years, we were able to get individuals access to hospitals and clinics just through letter writing. We didn't need to litigate. And that was really because the law, in our view, is very clear that everyone has a right of access to healthcare services, that free health services are available to a large swathe of the population, and that in terms of various regulations and policies, refugees, asylum seekers, and undocumented people from SADC states, which are, of course, the majority of migrants in South Africa, are entitled to be treated the same as South Africans, and so they are entitled to be means tested when they're trying to access services in hospitals, but are entitled to free services in clinics. And over the next 7 or so years, we were seeing at different times posters being put up in hospitals, different policies being enacted that sought to limit access to services. And every time that happened, it was challenged just through letter writing, and the policies were revoked and the posters were taken down. And so we were never able really to challenge the core of the issue, which was that while we said the law was clear, there were some details that made it possible for people to be turned away from services, and that it really relied on people being able to access advocacy organizations, lawyers, etc., where there had been problems. Then, of course, in 2019, there was the NHI bill. And what that bill showed is that there was an attempt to decrease access for migrants. In the NHI bill, it sets apart refugees who are treated like South Africans, but then everybody else, asylum seekers and undocumented people, are only entitled to emergency medical treatment and to treatment for conditions, for notifiable health conditions. So those are things like tuberculosis, like COVID, but not for ordinary health services, including primary healthcare services. So we saw this real intention at national level to decrease access for migrants. And Section 27 and the Migrant Health Forum and a number of other organizations wrote submissions in that regard that mostly haven't been listened to in the rewriting of the NHI bill, and I think really subject the NHI bill to the likelihood of litigation by us and others when it finally becomes an act. So that's 2019, and then in 2020, during COVID, we suddenly saw a change in policy from Gauteng. We saw a new policy and new regulations that again sought to exclude some migrants from access to services. And we were hoping that this was going to be like it had been before, a case of a new policy being put forward, we challenge it, and it gets retracted. But that didn't happen. And as we were trying to assist individuals to get access to services, they were being turned back on the basis of this new policy and circular. And at the same time, a baby under 1 year old was died as a result of not being able to get access to services when he swallowed rat poison and was turned away from multiple health facilities because his parents were undocumented and Zimbabwean. And so that really showed the dramatic impact of this discrimination against migrants. And that case, the case of baby Ncube, was taken up as a damages claim separately. But Section 27, along with 3 women, two of whom were representing themselves as pregnant women who had been turned away from access to services, and one who was speaking on behalf of her child who was under 6 and had been turned away, brought an application against the National Department of Health, the Provincial Department of Health in Gauteng, and the CEO of Charlotte Maxeke Hospital, because that's where the bulk of the complaints were coming from. And in that case, I'll tell you what we asked for in a moment, but we were supported by amicus applications from the Center for Child Law, from the International Commission of Jurists, from Amnesty International, and from the Special Rapporteur for Health and a number of other UN mandate holders who were represented by Lawyers for Human Rights. So those were all amicus applications in this case. And in the case itself, we were supported by an expert affidavit from Joe Veary of ACMS, by MSF, and by a number of other organizations, including COMSA, Future Families, and others. So it was a real collaborative effort to bring this litigation. And what we were asking for in the litigation was for a declarator So a declaration from the court that Section 4 of the National Health Act means that all pregnant and lactating women and children under 6 are entitled to free healthcare services, not just at clinics, but also at hospitals. And that anything that goes against that is invalid and inoperative. So the hospitals ordinance, which is this ancient piece of provincial legislation that was questioning that was inoperative. The new regulations were inoperative. And importantly, the directives and the posters that get stuck on the walls, because we know that sometimes it doesn't matter what the law says. If there's a poster on the wall, that's what gets followed. So anything that was contrary to Section 4, which provided that everyone in this category got access to services, that those were all inoperative. We also asked for the amendment by the Gauteng Department of Health of their guidelines and their regulations that had walked back access for pregnant women and children under 6. And we asked, importantly, for new circulars to be issued by the National Department of Health to all provinces, not just Gauteng. So that's also relevant. And to lay out what their obligations are in relation to Section 4 of the National Health Act, to say specifically that all pregnant women and children under 6, all lactating women, regardless of citizenship or documentation status, are entitled to access services at hospitals. So that declarator needed to be sent out, and that posters needed to be put up in health facilities across the country so that people working at the facilities, but also patients, would know what the rights of this category of person is. And we got this order. The deputy judge president, in managing the case, there was a kind of a long litigation process, but the deputy judge president eventually gave us our order. And interestingly, he added the requirement for a report back. Thanks, Marlies. He added the requirement that the various state role players had to take the steps that were required, and then had to report back to the court on affidavit at various times, and then again to return to court in person. So the head of department, the MEC, etc., had to return to court to account for what they've done. What we've seen in the intervening, I guess it's about 4 or 5 months, is that we've received far fewer cases of people who are being turned away. And when we do receive cases and we take up the issue through letter writing, we're able to get people access to the healthcare services. So that's very positive. We know that the circular has been sent. We know that some hospitals do have posters, but the majority of hospitals that we have gone and monitored at still don't have those posters. And so there's still a really important element of the court order that is lacking. We are going to be returning to court on Monday. That's our return date. And what we're going to be putting before the court is a summary of the monitoring that we have been doing that shows the facilities that do and don't have posters. And that's monitoring that we did last month, and we are doing further monitoring tomorrow in Gauteng to establish the extent of compliance. And we're going to ask the court to take action in relation to that. We're not sure exactly what the court is going to do, because he just asked for everybody to return to court, but we hope that he's going to require compliance, and that and we think that there is a case to be made for contempt of the court's order, because there hasn't been proper compliance. So as the report suggests, this case is a real example of shifting goalposts. It's been a long and winding road, and the goal doesn't always remain the same. But Monday is an important next step in this campaign. Thanks, Marlies.
Thank you so much, Sasha. And I've added some URLs in the chat box of some of the really useful material Section 27 has produced. Sasha, if there's anything I've left out, please add it to the chat box. I am going to welcome Janet Nakamwe from the Africa Diaspora Workers Working Group to join us on screen. Janet, if you can, I know you have some bandwidth limitations, so you're welcome just to put yourself, to unmute yourself. I will come back on screen when you have 1 minute left. Over to you, Janet.
Oh, thank you so much, Marlies. Just to put the face, so that at least people can associate whatever is going to come out from this mouthpiece through the mic with the person. Unfortunately, my network is quite horrible. This side, I'm actually traveling. So yeah, I'll just shift and switch over to the mic and switch off my video. Thank you so much. And thank you so much, colleagues, for inviting the African Diaspora Workers Network, of course, and obviously a member of the Kopanang Africa Against Xenophobia, and to be part and parcel of this very important panel. And the launch, of course, this launch is seminal, I must say, because over the years, we have had so much being said about xenophobia, but not much being documented around the medical xenophobia. Thanks, Becky, at least for some heads up. And I'm glad that at least in your analysis, you decided as a team to actually expand the concept of, health xenophobia beyond the medical xenophobia, which is quite, like you rightly indicated, intimate between the relationship between the public health workers and, of course, migrants who seek medical services on a daily basis. I think this is something that is highly applauded. So for me, I guess the starting point and what I find very interesting about this particular report, given the time frame that I've been involved in activism here in South Africa since, I must say, the time at which I was really directly involved was the 2008 attacks, in which the Coalition Against Xenophobia, which was dubbed CAX by then, was established. Why this is important for me is that we have noted over the years that xenophobia continues to mutate. It's like a cancer, right? It's mutating, or should I say in medical language, the process of meiosis, where it's really kind of, change over time, not for the good. Actually, we all know what mutation or meiosis is all about. It's actually to further divide, in this particular case, the society is further fragmented based on who they are and where they come from. The unfortunate thing is that as xenophobia continues to gather momentum since, I can say, the lockdown time, because I must actually, if we are to look into the timeline of this xenophobia and how the CSOs have been responding, or the interventions thereof, you'd find that from the point of 2008 up to the point of 2012, thereabout, there were some very notable interventions that took place, led by CSOs, community-based organizations, NGOs, and all those progressive leftist forces. Of course, are united together under the force of the Coalition Against Xenophobia, which was CAX, not our own current CAX with the K. So what was very significant about this particular period for me is that there was that kind of unity forged among various players, whether academics, CSOs, CBOs, and all those, including the city of Johannesburg. Actually, I guess that's the point at which we also witnessed the establishment of the Johannesburg migrant desk under the leadership of the then Mayor Masondo. And this was all because of pressure that came from CSOs. And of course, I mustn't forget the public litigation organization, public interest litigation organizations like Lawyers for Human Rights, they've always been there. There's also other players like Legal Resource Center and obviously the Methodist Church. I'm glad that it has been mentioned, and the MSF by then, which actually to some extent could be the reason why we witness somehow little overt, a few overt cases of medical or health xenophobia in a way, because MSF really played a very fundamental role. But of course, everything was kind of synergized or brought together because of the intervention of the City of Johannesburg. So my question is, where is the City of Johannesburg today in as far as engaging the CSO, all those players who are in this particular sector? I know there was this structure that was established, the JMAP and JMAC and all those kind of. So I was tempted to actually respond and say something, because this was actually a victory from all the struggles and interventions by CSO then, you know, following the 2008 xenophobic attacks. Then fast forward, we took a lull period, I must admit, because I'm also one of the activists who have been really, really much involved in this. We even had a dubbed mesh that would be hosted annually. That was the Ubuntu Derby, which was still supported by the City of Johannesburg and other players like, let me say, the Gauteng legislature. So in that sense, I think from the leftist movement who actually really cared about this issue of xenophobia, it's not like it was so easy for City of Johannesburg to grab and come and work together with social movements. But it was all because of the pressure that was actually, imposed on the powers that be. And the same applies when Mashaba, when he was mayor, wanted to begin to introduce the issue of, his xenophobic remarks. And I still remember as African Diaspora Forum, by then, all the collectives, all the organizations under that umbrella, we went early in the morning to go and just remind him about the Johannesburg, City of Johannesburg migrant desk. Fast forward, so the issues here, I think in terms of the timelines, we certainly need to take also into account those particular victories by CSOs by then, because some of the aspects we see today, it's not like they just were a mechanical process, they just came from nowhere. They actually came as a result of unity, forged around this particular of fighting xenophobia by then, which actually I can argue that today we experience more of institutionalized xenophobia. Why? Because a lot of ground has been covered in terms of conscientizing communities, which is why we have, even among the KEX collective, we have quite a number of CBOs. I think we have, I won't mention
Janet,
all of them. Hello?
Sorry, Janet, your time is up. Would you mind wrapping up?
Okay, sorry. I think I was tempted by the historicization of it. History is too long. Sorry. Thank you. I think that's precisely some of the key points that I wanted to raise. But some part of the way forward, what would we expect as a network moving forward from the collective voice and everyone else here in this room today? I think what is critical for me is to have a regional approach to our interventions. Move beyond South Africa. Let's not have this problem of health xenophobia being our burden only as CSOs or NGOs here in South Africa. But if we connect with like-minded organizations across the region, beginning with the SADC region, across Africa and across the globe, I think we'll have some more meaningful, interventions and grassroots, kind of strategies that are actually would have some meaningful, outcomes in a way. But most importantly is to actually, take this particular reports and all that matters to the regional leaders who actually care more about their solidarity of convenience when it comes to, power and everything, but begin to demand as, representatives of the ordinary grassroots to say, we want a response to this. If at all a Zimbabwean woman has to skip their border to come and deliver in South Africa simply because your fellow brother has felt his own people, then at least we should certainly need to change the ways in which we can actually strengthen our interventions and mobilization around this particular issue. I thank you. Sorry.
Janet, thank you so much. Thank
I
you,
had to
Janet.
check now.
Janet, if you have any materials that people should pay attention to, please put them in the chat box. I'm going to ask Nigel to please come on screen. Nigel is a colleague from Kopanang Africa Against Xenophobia. Nigel, we're looking forward to hearing you.
Hello, everyone. Before we delve, I think, into today's conversation, I just want to stand in solidarity, I think, with the people of Palestine. I think Gaza's health ministry announced yesterday that there was 2,750 Palestinians who've been killed, including over 750 children, 9,700 people wounded in Israeli strikes on Gaza. And I want to say, I think we must reject the othering and diminishing of the people of Palestine with as much passion as we reject the xenophobia against fellow Africans and the people in South Africa who are Black and poor. We're all bound by our shared humanity. It's been 47 days since that devastating fire that officially took the lives of 78 individuals and injured many more at 80 Albert Street in Marshalltown, Johannesburg. I think that more than the loss of life, the fire has displaced about 500, just 501 people is what we've got through our interviews, including children that are as young as 3 weeks old. They've suffered physical scars, trauma, unimaginable loss. And all the lives that have been affected in this fire have to be considered worthy of humanitarian action and legal intervention. But in the aftermath of the fire, politicians hastily labeled the building's occupants as predominantly illegal immigrants. And they furthermore blamed NGOs for the state that the buildings were in and say that they had prevented the city from implementing actions to sort the problem out. We, as civil society organizations, individuals, activists, started meeting with the victims of the fire, and we started trying to assist. The state nowhere got involved in assisting apart from setting up this temporary emergency shelter and then getting NGOs to deliver all of the support that was needed at the shelter, and then withdrew after a few weeks. We conducted quite meticulous interviews with every single survivor, and we found that over 50% of survivors were in fact South African citizens, 264 of the 501 to be precise. Additionally, many were refugees, many were asylum seekers, and many were documented. Only between 3 and 7% were seemingly undocumented. So this is a crisis that has happened that both migrants and South African citizens are enduring immense distress. And many have been at the Hoffland Park Recreation Centre in Bears Valley for over 6 weeks. They're facing crowded, cold, and unsafe conditions. Just last night, we had a theft at the shelter. or the night before last, where all of the food was taken. 4 nights ago, there was a xenophobic attack on the shelter where some community members broke in and started shooting up into the air and telling the residents of the shelter, the victims of the fire, including South African citizens and children and women, that they must leave. The government just is not intervening. They haven't assisted. We've called for them to declare a disaster, and instead of declaring a disaster, they've created and maintained one. I think one thing that has struck me from the report when I read it before was it talks about the urgent need for debunking fake news and to counter the scapegoating narratives. This is not just a fact, it's a call to action. And I think that the story of the Marshalltown fire echoes this. The violence, in my view, of fake news leads to the violence of prejudice, and it's the violence of prejudice that leads to the violence of exclusion, and it's the violence of exclusion that leads to the violence of it, and it's the violence of prejudice and exclusion that leads to the violence of indifference. It's this pernicious cocktail of lies and prejudice and exclusion and indifference that we together need to confront as we head up to the 2025 elections. And we're seeing increasing statements being made by politicians of their intent to further exclude, to further to other, and to further scapegoat the most vulnerable. So I just want to tell a few stories before I talk about some of the things that I think we need to do. So the first story I want to tell is a story that I still can't believe, but I witnessed it. You know, it was in the days after the fire. We were at the scene, and crowded onto the back of trucks were all of the people paying to go to the first funerals. Many of the victims were Malawians and were Muslims. And of course, in the Muslim tradition, you want to bury your loved ones as urgently as possible within the same day. And so they were told that 12 bodies had been identified and they would be buried that evening. So they all got on these trucks and they went to Lenasia, to the cemetery there, which if you live in Joburg, it's, you know, half an hour, 45 minutes drive outside. They get to the cemetery and they wait, and the bodies don't arrive. And what we were told was that 9 bodies were supposed to be released, but they were only releasing the bodies in groups of 10 because they had set mass graves in place to bury these people. And there was a whole lot of intervention then from Muslim aid agencies, and the next day 10 bodies were released and the people buried their loved ones. But the people who had gone to the funeral, many of them only had the money that was on their hands, and they walked back from the funeral, and many of them were then arrested. We had 12 people arrested in Lenasia who were walking back from the funeral because they didn't have documents, and they didn't have documents because they lost them in the fire. I wish this was an isolated story, but the stories have gone on and on and on of exclusion from the government, of the way that othering has impacted the lives of these victims. And when we talk about where we're at in South Africa, I think we're at a critical juncture and we need immediate action. We need to work together as a collective, as collective voices, as Kopanang Africa Against Xenophobia. We need to put together a comprehensive legal strategy to combat hate speech, especially as we approach the elections. We need to get the legal NGOs in the city together to deal with the documentation crisis, to deal with the registration even of Operation Dudula as a political party. I mean, how can we have a political party that essentially violates our constitution? We need to have a legal strategy to take on all of the xenophobic actions that are happening, not only in health, but in education, and in housing. I think one of the things I learned from this was that the xenophobic narrative is put in place for a couple of reasons. And we certainly witnessed this in the city. Was number one, it was put in place so that the city can absolve itself of blame for the fire. And I think we have politicians in South Africa, we have a collective in South Africa that is completely absolved itself of the lack of a development agenda, of the lack of actually implementing our constitutional objectives and imperatives. The second thing the statement did was it
Sorry,
excused...
Nigel, I feel dreadful, but I'm going to ask you to wrap up.
Oh, sorry, I didn't see you there. It excused collective action. And then thirdly, so it excused their responsibility for acting. And then thirdly, it created a national state of indifference. And I think it's that national state of indifference that then makes it more difficult for our efforts to continue. So what I'm going to ask Marlies to do is just to put up a call to action that that myself and Sharon and her quickly worked on before the meeting, because I think that it would be important for us to work together to counter fake narratives, to get a legal strategy together, and to work together to address xenophobia more formally. I think we really are the ones we've been waiting for. We are the ones that need to rise up and to take action to combat xenophobia going forward. And unless we collectively work together to address this, we're not going to see the victory. Sorry for going slightly over, but thank you very much.
Thank you, Nigel. I'm going to put up your, could I perhaps ask you if you could copy it in? If you can't, then I'll do it. I saw that my text was too long for the chat and I haven't had a chance to chop it in half. Thank you so much for that, Nigel. I am going to ask our last speaker, Sophia Wells, who was on the organizing committee of the Brixton Lights Festival, to please come on screen. Sophia, please unmute yourself and let me know when you want me to play the video.
I don't know, do you want to start with the video?
Let's do it. Let me just find it first. Sorry.
Thanks. Negative childhood experience. You have a positive childhood experience, something that you would remember for the rest of your life. And so we thought about what would be the thing that you would remember for the rest of your life. And we put as many of those moments together. So I think you can just watch the pictures then as they go past, and I'll explain a little bit about it.
But this is the Brixton Light Festival that happened, unfortunately, just after the tragic fire, a few kilometers away from us. And to start the Brixton Light Festival, we actually had, we played a piece of music and paid tribute to all of the lives lost and the destruction, and also to the emergency services that had responded. There were some of those guys in attendance at the Brixton Light Festival because they are at the Brixton Fire Station here. So this festival is actually a culmination of all of the things that the Brixton community has been working on for, I think, nearly 2 decades. It's something actually that Marlies was involved in when she was here, but also so many other people that have contributed to it. And I think it's a need in this neighborhood for wanting to live differently, to be surrounded by people that that care about us and that we care for. And so I think there are 2 aspects of it, or 3 even, that are really that worked for us. The first was that in 2018 we met with the African Reclaimers Organization. They weren't even officially the African Reclaimers Organization yet, but all the guys that have their trolleys and collect recycling. And we spoke about having a formal relationship between the Residents Association, the residents, and the reclaimers. And out of that came so many conversations about, you know, how we make our space safe, how we make community. And of course, many of these reclaimers are foreign, many don't have documents. And when it came to lockdown, it was such an incredible thing because we now knew the names of the reclaimers in our streets. They were definitely people, they definitely needed things. And the response from the community, I thought, was quite incredible. So in order to do any kind of relief effort, they needed a vehicle, and somebody just said, well, I'm not going to work, so you can use my car for that. So there were all of these really incredible, you know, people making soup and making stew every day and feeding people everywhere. We had stations where people could wash their hands at various houses. We did some breakfast meals, that kind of thing. And I think from that starting point, we actually got to know a lot more of our neighbors because we had a list of who was vulnerable in Brixton and really needed food. So I think before lockdown, we didn't have as tight a community as we have now. So the Brixton Light Festival also had various elements in it to address xenophobia. We've had Operation Dudula attempt to open their own branch in Brixton. I'm not sure it's been terribly successful, but yet they did do a march, and they have been around. And so we did various things to make sure that our community could take part and get to know neighbors better. And one of them was to say, okay, if we're going to do this Brixton Light Festival, one of the things we want to create is a childhood experience that you will never forget, a good childhood experience. And of course, that becomes a good adult experience for us too. But out of those, we had so many stories. And so the narratives from migrants were very present in this festival, starting with a story about migration with ships, which I think you saw the images of, by an artist called David Gara, who comes from Zimbabwe and told his story. And then also the project that I'm working on, which I'm really excited about, and I hope everybody here could join me on, which is the giant puppet, Little Nana. She rides on her trike, and she's from Zimbabwe, and she's 10 years old, and she wants to be invited by you to come and visit. And the welcoming that she got at the Brixton Light Festival is incredible. But we've also now done some runs in George and Oudtshoorn, and it just has been an incredible thing to watch, especially how children see her very much as a person that needs to be looked after, and how resourceful they are wanting to look after her and make a plan. We understand she's a very big puppet, you know, she's alone, she's looking for her mom, she's looking for her new home. What can we do? So many of the kids suggested that she should have a pet, or she should have a friend, or, you know, where's an adult puppet to look after her? And when there was none of that, they said, well, we could be her family, and we could show her around, you know, where the best place is to get a quota, or what's the, you know, we'd figure out how to arrange for her sleeping arrangements and that sort of thing by asking the principal if she could sleep in the school hall, for instance. And I was really overwhelmed by how beautiful and compassionate and resourceful these answers were, and that they were really dealing, a lot of these kids are dealing with the problems that we're facing as a country, of there are people here, we don't have the resources, what are we going to do, how are we going to share these things? And being a good neighbor and living in a place where we are good neighbors to each other was really important for those kids. And I hope that we can also say, we want to see a different South Africa, we want to see an inclusive space, we want to see all of these dreams that these kids have, and that we can take those dreams and also share them with policymakers. But I think that little Nana is far too big to ignore. She is really going to be quite something. I hope she's going to be a joyful addition to your work, everybody. I wanted to really contribute to that, and I'm very grateful to all of the organizations that have made it possible to make her, and to have her be there. So I hope everybody got pictures of little Nana in the video, but she's 4.5 meters high. She's really quite something to see. So I hope we can introduce her to all of you along her route as she spreads her message, and I hope that you can add to this collective campaign.
Sophia, thank you very much, and thanks for people's patience with the sound. I'm hoping that the visuals gave a good sense of the festival itself. I'm going to thank our speakers, and I would like for us just to take a moment to think a little bit about the spectrum and the wealth of information and wisdom that people have shared. And I'm going to open it up for questions and answers. We're going to, and comments. We're going to go back to Nigel's, what I think is a very valuable statement of intent. So your task this afternoon in the next couple of minutes is a wide one. You're welcome to ask a specific question to any of our speakers, to share some reflections, to tell us what you think about having a statement of intent. And I'm going to suggest that people use the chat box, or actually preferable if you put up your hand so that we can see what you look like and your voice. Any takers? Usually in a face-to-face situation, this is where I would say I have facilitated many workshops, and I am happy to sit here for a long time until someone puts up their hand, and I'm very patient, so I can do that as well, but the peer pressure is less if we are all on Zoom.
Are panel members allowed to ask questions?
I would be so delighted if the panel members want to ask questions. Go ahead, Sophia.
Thank you. I wanted to ask this group, because you're all so knowledgeable in the sphere, what would you do next if you had this possibility to have an integrated campaign across health, education, an anti-xenophobia campaign, and you had, say, this puppet, Nana, at your disposal? What would you do first? What would be the first thing that you would attempt to do?
Thank you. Any reflections on Sophia's question? Sophia, sorry, would you just say 1 or 2 words where Nana is at the moment? You did.
So Nana's actually back at she's back at her workshop in Wilderness, having a few things repaired. The kids really got into it and started sort of pulling at her toes and things. So she's having some surgery, but she's going to be coming up to Joburg soon. Yeah.
And your question is, what should Nana be doing next?
Yeah, how could she help the organizations that are in the room here now? What would be the best next step? And I mean, it doesn't have to involve her, but what would the next integrated campaign step be? Does everybody have an idea of what that first step should be?
Nice. Thank you, Sophia. Nigel, please go ahead.
So I'm just responding to the peer pressure of having to have somebody speak. But I think that I was just thinking that going back to that report that was shared at the beginning and talking about this collective action, you know, and I think what was powerful in the report, one of the other things that was powerful was just, there was that one slide that was shared where it had all the different kinds of actions that we've been doing over the last 20 years, from illegal things. And for me, personally, I think one of the most powerful things we can do is to continue to organize in our communities against xenophobia. And it's organizing little groups in our small, it's organizing us to be in small groups in our communities, on our community WhatsApp groups. And I think that's where we need to be taking Nana into, but as part of bigger initiatives. It would be really great to have those fun elements as part of that. So I certainly was quite inspired to think about, you know, like what you've done in Brixton, using it in the Festival of Lights, to use it in areas and other communities that we're in as we do these anti-xenophobia initiatives as part of our community organizing.
Thank you very much, Nigel. Sharon.
Thanks, Marlies. I think that Nana is symbolic of, you know, that section of our society, which for me evokes sentiments of caring and love. And I think that it, just like Collective Voices evolved, as we heard, you know, how its name evolved to build and incorporate solidarity. I think in a similar way, we need to see how Nana as can contribute as a little child or a young person to a more caring society, but to build bridges. So, you know, if you look at the timeline, one thing I would point out is that there's been many movements, many initiatives that looked at the infringement of rights and dignity of migrants and foreign nationals. But Nana is symbolic of it's universal. And that's what really captures my imagination. It doesn't have a national or nationalism or chauvinism. It doesn't even have a sexual identity. And I think those are all things that we need to be celebrating in building a society that is caring. So I'm not giving you anything specific, but the symbolism is just incredible and refreshing, and can bring positive change if we can incorporate it in all the work that we're doing.
Thanks very much, Sharon. Anyone else who has any reflections, any suggestions to add, anything that struck them about the research findings and whether some of those resonated or perhaps not resonate at all? Yes, Ronald, please go ahead. Ronald, you're welcome to go ahead if you want to unmute yourself. Ronald, unfortunately, we can't hear you. If you would like to pop your question in the chat box, then I will read it out. I'm going to keep the floor open for a little bit more. Any reflections? Ronald, you good? I think it might have been a long afternoon. My suggestion is going to be, I think the statement of intent is a really powerful and concrete summary of some of the points that we've been discussing here with a spectrum of speakers. And Nigel, let me pause there before I make a suggestion. Please go ahead.
No, I was hoping you would make the suggestion, then I was going to come in afterwards. But what I
You
was
go
going to
ahead.
I was going to suggest with regard to the statement of intent that, or just motivate a little bit of the points. You know, first, I think that the big issue is the fake news that is driving so much of the xenophobia, and linked to that is the scapegoating. And so we've used these narratives, but we really do need subject experts to help in debunking this stuff. We need the research done, and we need the subject experts to debunk it in media, and then we need this kind of coordinated legal response as well. So I know that we've talked about people joining Collective Voices, but also joining CACS. I've put my number in the chat. If anybody is keen to get involved in CACS, we've got 5 working groups. The first working group deals with media, and we need volunteers to help us draft media statements, to be spokespersons from your organization and from CACS. We need legal and litigation. We need people to help with that. Political education, we're trying to help communities to organize themselves and get involved in anti-xenophobia work. We've got mobilization and outreach, which is really around trying to respond to some of the attacks that happen. So especially like in Mayfair at the moment, there's a burgeoning kind of xenophobic, and also in Naledi, as we know, around this inverted comma poisoned food stuff, and we need to have teams that kind of respond to that. So this, and then we've got a fundraising and finance team, but those 4 teams essentially are where we need volunteers. And it's just about how do we pool our resources together, and it doesn't necessarily need to be in the name of CACS, but let's work together so that we can feed each other, and we can create the platforms for each other, and we can bounce off each other, and we can use our common assets to really confront these narratives. I really think we've got to work together.
Thank you, Nigel. Janet.
Oh, thank you so much once again. Sorry, Ronald, I guess he's got some challenges with his network. But quickly to just add on to the dialogue itself around the launch, I think a key question and point that I want to raise that I couldn't articulate then is that we can't talk about health xenophobia in isolation. Currently, the country or everywhere else globally, there is all this, multifaceted, what we call polycrisis. So the same as here in South Africa, we have the energy crisis. Now it's water crisis, and this is more likely to even add fuel, petrol to the fire that's already burning in as far as xenophobia is concerned. Bearing in mind, for example, the remarks by Mackenzie during COVID, and even recently, that you could just take away the oxygen from any foreigner and give it to the local. So what are we more likely to also face as we more likely to experience more and more, like, for example, water crisis, or even the energy crisis, access to oxygen in the hospitals? So those are some of the questions perhaps that we need to begin to think beyond this particular session, and how we view xenophobia in the conventional ways. We're more likely to have perhaps now people shouting to say, no, we can't have a foreigner having access to water before we get it, even in the hospitals. That's just it. Then on Nana, thanks so much, Sophia. Very interesting and intriguing. I guess what I really liked from that particular imagination is that, you know, I think everybody loves a child. I don't think it would be absurd to find someone anywhere in this world who hates children. So it was such a very well thought idea of bringing in the voices, amplifying the voices of the migrants, you know, in the personality of a child. And hopefully the powers that be are gonna give our little Nana enough ears and take seriously whatever messages that she's gonna bring on board. Thank you so much.
Thank you very much, Janet. I am going to suggest that people look at the statement of intent. It's in the chat box. And if you are interested, or if you think that this is the correct course of action for our research launch to take, to put a thumbs up there. And if the majority of people on this call think that this is a statement that correctly summarizes some of the main points that come out of the webinar, then we will publish it together with the research launch, and will help, I think, inspire some of the next actions of the coalitions and of the organizations and individuals here. So I'm going to ask that people look at the posts that Sharon and Nigel have included, and if you're happy with that, put a heart or a thumbs up, and we will include that statement on the website and circulate it through our networks. Unless there's any other reflections, I'm just going to have a look. I see Paulette giving a thumbs up. I'm going to close this launch, and I'm going to thank everyone for those who participated, those who supported, and those who provided remarks and wisdoms here. And especially a big thanks to Becky and Ariane, who worked really hard on putting together what I think was a report that was very ambitious, of summarizing key findings of 20 years of very diverse activism, and for all our supporters and people who made this work possible. Thank you very much, everyone. And we will circulate the materials afterwards. So keep an eye on your inboxes. Thank you very much.
Thank you so much, Marlies and
Thank you,
team.
Marlies and team. Thank you.
Thank you,
Unfortunately,
everybody.
many people struggle to join using that other old link. Sorry. But great.
Thanks, everyone. Bye-bye.